My name is Rakeen, and today we'll be talking about International Nurses Day as part of this month's Health Talk. So, International Nurses Day is on the 12th of May 2026. Our nurses, our future, empowered nurses save lives. What nurses do? Nurses in Malaysia. So, what is International Nurses Day? A global observance held every 12th May to honor the dedication and contributions of nurses worldwide. The date marks the birth anniversary of Florence Nightingale, she lived from 1820s to 1910, who is the founder of modern nursing. First proposed in 1953, officially celebrated since 1965, and fixed to 12th May by the International Council of Nurses (ICN) in 1974. So the 2026 theme is Our Nurses, Our Future, Empowered Nurses Save Lives. So let's talk a bit about the founder, which is the Florence Nightingale legacy. Born 12 May 1820 in Florence, Italy, revolutionized care during the Crimean War from 1853 to 1856. She reduced mortality from over 40% to approximately 2% through sanitation reforms, pioneered data visualization with polar area diagrams, founded the first professional nursing school at St. Thomas Hospital, London in 1860, and is known as the Lady with the Lamp. So why does International Nurses Day matter? First day is recognition, honors the courage, skill, and compassion of nurses who frequently work under severe pressure. Next is awareness, highlights workforce shortages, inadequate wages, and unsafe working conditions globally. Advocacy calls on governments to invest in nursing as a national development priority and the global impact. 29 plus million nurses and midwives form the backbone of healthcare worldwide. So what do nurses do? Nursing integrates the art and science of caring, the protection, promotion, and optimization of health and human functioning. So under clinical care, here are the things they do: patient assessment and monitoring, administering medications, wound care and treatment, vital signs monitoring, and emergency first response. Under education and advocacy, they help to promote health and prevention, patient and family education, advocacy for patients' rights, counseling and emotional support, and disease management guidance. And systems and leadership, they help to care, coordination across teams, research and evidence-based practice, policy and healthcare reform, quality improvement, and administrative leadership. So there are over 20 specialized fields spanning every area of healthcare regarding nursing specializations, which include, but not limited to, critical care and emergency, pediatrics and neonatal, oncology and palliative care, mental health and psychiatry, community and public health, surgical and perioperative, obstetrics and midwifery, geriatrics and elderly care. Global nursing workforce, let's talk about the statistics. There are about 29 million plus nurses and midwives worldwide. 59% of all health professionals are nurses, and 5.9 million global nursing shortages. The WHO warns that without urgent investment, the global shortages will deepen. Nurses are central to achieving universal health coverage, disease prevention, maternal care, and emergency response. So let's look into nursing in Malaysia, the challenges, achievements, and the road ahead. A bit of a history of nursing in Malaysia. So in the 1800s, nursing began with the arrival of East India Company hospitals established in Penang and Singapore run by Catholic nuns. In 1923, introduction of legislation for control of midwifery practice and training in the Straits Settlement. Pre-war on-the-job training with lectures by European sisters, matrons, and doctors, varying standards from state to state. In 1952, Malaysian Nurse Association (MNA) founded, now representing 19 branches from 14 states. Post-independence, the Nurses Act and Nurses Registration Ordinance enacted to control nursing practice nationally. And currently, MNA affiliated with ICN, Ministry of Health oversees nursing standards, education, and workforce planning. Malaysia's nursing workforce. Currently, 43,243 nurses are needed to meet Malaysia's public health care demand. About 1,754 nurses have resigned from public services in the past 5 years, and their current starting salary is about 1,797 ringgit per month for entry-level nurses. So the key challenges facing Malaysian nurses, firstly, is the severe workforce shortages, a shortfall of 40,000 plus nurses, new medical facilities opening faster than staff can be recruited, patient-to-nurse ratios are dangerously high, low pay and poor retention, starting salary of 1,797 per month, only 100 ringgit monthly allowances for specialist nurses, 6,919 healthcare workers left public sectors from the year 2020 to 2024. Technology gap. Only 8% of Malaysian hospitals have integrated computerized systems for record keeping. Nurses spend excessive time on paperwork instead of patient care. And brain debt abroad. So brain drain abroad. Better pay and conditions overseas continue to attract Malaysian nurses to other countries. Private sector offers significantly high compensation. So what does the government do and what are their responses? So we talk about budget 2026, 46.52 billion allocated to health ministry, about 11.4% of total federal budget. Includes 935 nurses offered permanent positions. So on-call allowance increased by up to 40% with 120 million annual allocation, and about 2.2 billion for construction, maintenance, and repair of civil servant quarters. Total Hospital Information System (THIS) expanding to 16 hospitals. Cloud-based Clinical Management System (CCMS) rolling out to 2,489 primary health facilities. Future of Health Workforce Strategic Roadmap submitted to the Health Minister in June 2024, and Health Minister's 4 major leaps for 2026: digitalization, financing reform, human capital, and public health ethics. It's on the star. So the Malaysian Nurses Association and Education. Malaysian Nurses Association, which is founded in 1952, has about 19 branches from 14 states, 3 universities, and 2 private hospitals. Only Malaysian Nursing Association affiliated with ICN and works with Ministry of Health to promote nursing standards. Their vision: premier association for all registered nurses in Malaysia. Then there's the Nursing Education Pathway, which is the diploma in nursing for 3 years, followed by Bachelor of Nursing 4 years. Post-basic specialty programs are available and recognized by Malaysian Nursing Board (LJM). Continuing professional education (CPE) encouraged but inconsistent. Only 80% participate. So the human side of nursing. One can imagine how exhausted nurses here are compared to overseas, where nurses only focus on their respective nursing care duties. This is the quote by Saida Athman, President of Malayan Nurses Union. Malaysian nurses perform double duty, not only patient care but administrative tasks, transporting patients and managing medicine trolleys. The 45-hour work week transition has added to the burden, with little flexibility for personal recovery. Empowered nurses save lives. What nurses empowerment really mean? Firstly is fair compensation, competitive salaries, specialist allowance and pension security, safe workplaces, adequate staffing, protection from violence and manageable hours, professional growth, access to continuing education, specialty training, career progression, leadership roles, inclusion in decision making, policy development and healthcare reform, digital support, technology integration to reduce paperwork and improve care delivery, and mental health, emotional support, burnout prevention and recovery time. So the key takeaways: number 1, International Nurses Day, which is held on 12th May of each year, celebrates 29 million and above nurses worldwide who form the backbone of global healthcare. Number 2, the 2026 theme is Empowered Nurses Save Lives, calls for action, not just appreciation. Number 3, nurses do far more than bedside care. They are educators, advocates, researchers, and leaders. Number 4, Malaysia faces a critical shortfall of 43,000 plus nurses, driven by low pay and heavy workload. Number 5, the government is responding with 46.5 billion ringgit in health funding, digital modernization, and workforce reforms. And number 6, investing in nurses is not just a healthcare issue, it is a national development priority. Thank you, nurses. Empowered Nurses Save Lives, International Nurses Day, 12th May 2026. Okay, thank you.